What if the real danger to your health wasn't something loud or obvious, but something completely silent, lurking in your body every single day? No pain, no warnings, no dramatic signs. Just a quiet ticking time bomb, waiting for the right moment to explode. High blood pressure, or hypertension, is often called the silent killer for a reason. Most people don't even know they have it until it's too late. And by the time the symptoms appear, serious damage may already be done to your heart, your brain, your kidneys, even your eyesight. Welcome to Healthy Start, where we break down health issues in a way that's clear, engaging, and truly life-changing. Make sure to subscribe to Healthy Start and turn on that notification bell so you don't miss out on more content that could literally save your life. You see, high blood pressure isn't just about a number on a screen at your doctor's office. It's about what's happening inside your body every second your blood pushing too hard against your artery walls, day in and day out. That extra pressure wears down your blood vessels over time, weakening them, making them vulnerable to rupture or clogging. Think of it like a garden hose being turned up way too high. Sooner or later, something's going to burst. But here's where it gets more alarming. This condition doesn't just harm one part of your body. It hits multiple vital systems. Your heart has to work harder, which can lead to heart failure. Your brain becomes more susceptible to strokes. Your kidneys begin to struggle with filtering your blood properly. And your eyes, the tiny vessels that are some of the first to show signs of damage often when vision problems begin creeping in. It's scary, but it's also preventable. The good news is, with the right knowledge and consistent habits, you can control high blood pressure and even reverse some of its effects. Over the next few minutes, we're diving deep into how hypertension impacts your major organs, what the real stats are behind the scenes, and how to protect yourself starting today. So buckle up and stay with me, because what you're about to learn could change the way you think about your health forever. High blood pressure doesn't just stay in your arteries, it ripples out, quietly damaging the most vital organs in your body, one by one. And because it often happens without symptoms, most people never see it coming until serious damage is already underway. Let's start with the heart, the engine of your entire body. When your blood pressure is constantly high, your heart is forced to work overtime to push blood against increased resistance in your arteries. This chronic strain causes the walls of the left ventricle, the heart's main pumping chamber, to thicken, a condition known as left ventricular hypertrophy. At first, this might seem like the heart is just getting stronger, but over time, it becomes less efficient, stiffer, and more prone to failure. The extra workload and oxygen demand can also lead to chest pain or angina, especially when the heart struggles to get enough blood during activity. And if left unchecked, high blood pressure becomes a major contributor to heart attacks, as it accelerates the buildup of fatty plaques in the arteries, leading to blockages or ruptures that can be fatal. The connection between hypertension and heart disease isn't a loose one, it's direct, aggressive, and deeply damaging. Moving up to the brain, the effects are just as alarming. High blood pressure is one of the leading risk factors for strokes. Why? Because it weakens the delicate arteries in the brain, making them more likely to burst and cause a hemorrhagic stroke, or to become blocked and lead to an ischemic stroke. Both scenarios can be devastating, paralyzing one side of the body, impairing speech, and sometimes resulting in death. But even before a stroke occurs, long-term high blood pressure reduces blood flow to the brain over time. This can slowly impair cognitive function, leading to memory problems, confusion, and eventually, vascular dementia. You might notice difficulty focusing, trouble remembering recent events, or a gradual decline in mental clarity. It's not just about aging. Hypertension speeds up the clock in ways most people never imagine until it's too late. Then there are the kidneys, your body's natural filtration system. Their job is to filter out waste and excess fluids, keeping your body in balance. But to do that, they rely on a network of tiny, delicate blood vessels. When blood pressure is too high for too long, these vessels become thickened or narrowed, reducing the kidney's ability to function properly. Over time, this leads to chronic kidney disease. In its early stages, It might not cause any noticeable symptoms, but as it progresses, waste products start building up in your blood. Swelling in the legs, fatigue, and shortness of breath may appear. In severe cases, dialysis becomes necessary to perform the function your kidneys can no longer handle. High blood pressure is, in fact, one of the top causes of kidney failure worldwide. What makes it more frightening is that damage to the kidneys can further increase blood pressure, creating a vicious cycle that's hard to break. Lastly, we come to the eyes. Though small, they're filled with intricate blood vessels that are highly sensitive to changes in pressure. Hypertension can lead to a condition called hypertensive retinopathy, where these vessels become narrowed, twisted, or even leak fluid or blood. At first, you might not notice any symptoms at all, but over time, vision can start to blur, and colors may fade. In more advanced cases, it can cause retinal detachment or bleeding, resulting in significant and sometimes permanent vision loss. The eyes are often called the window to the soul, but they're also a window into your vascular health. Regular eye exams can sometimes reveal the early signs of high blood pressure damage before symptoms appear elsewhere. Each of these organs, your heart, brain, kidneys, and eyes, plays a vital role in your health and well-being. High blood pressure doesn't attack them all at once, but its effects build over time, quietly eroding their ability to function. Understanding how hypertension harms these systems is more than medical knowledge, it's your first line of defense in protecting them. This isn't about fear, it's about awareness. And once you understand what's at stake, taking steps to manage your blood pressure becomes not just a good idea, it becomes a priority. High blood pressure is a global health challenge affecting millions of people, yet many remain unaware of its presence until severe complications arise. According to the World Health Organization, hypertension is responsible for nearly 13% of all deaths worldwide each year, making it one of the leading contributors to premature mortality. The numbers are staggering. Over 1.28 billion adults around the globe suffer from high blood pressure, but less than half of them have their condition under control. This silent epidemic continues to grow, driven by aging populations, lifestyle factors, and increasing urbanization. One of the most alarming complications linked to high blood pressure is stroke. Globally, hypertension accounts for more than 50% of all strokes, both ischemic and hemorrhagic. Every year, millions of people suffer a stroke, many of whom face long-term disability or death. In fact, stroke remains a leading cause of death and adult disability worldwide. High blood pressure weakens and narrows the blood vessels in the brain, increasing the risk that they will either become blocked or rupture. These events can happen suddenly with devastating consequences. In many cases, individuals were unaware they had hypertension until a stroke occurred, highlighting the silent but deadly nature of this condition. Heart failure is another major consequence of uncontrolled high blood pressure. It is estimated that hypertension contributes to about 45% of heart failure cases globally. Elevated blood pressure forces the heart to work harder, leading to structural changes like thickening of the heart muscle and eventually reducing its ability to pump blood efficiently. This progression not only diminishes quality of life, but also dramatically increases the risk of hospitalization and death. Around 17.9 million people die each year from cardiovascular diseases, with high blood pressure being the primary risk factor for many of these deaths. Kidney disease also stands out as a critical concern linked to hypertension. High blood pressure is the second leading cause of chronic kidney disease and kidney failure worldwide. Approximately 10% to 15% of patients with end-stage kidney disease requiring dialysis have hypertension as a root cause. The damage to kidney blood vessels caused by high blood pressure gradually impairs the organ's ability to filter waste from the blood. This silent deterioration often goes unnoticed until kidney function is severely compromised, forcing many patients to rely on dialysis or kidney transplantation for survival. What makes these statistics even more concerning is the widespread lack of awareness among patients. Studies consistently show that a significant proportion of people with high blood pressure are either undiagnosed or untreated. In many countries, nearly 30% to 40% of individuals with hypertension do not know they have it. This means they live with the risk of serious complications without taking any preventive measures. Even among those diagnosed, poor medication adherence and lack of regular monitoring worsen outcomes. These numbers paint a clear and urgent picture. High blood pressure is not just a common condition, it is a major global health crisis silently driving millions toward disability and death. Awareness, early detection, and effective management are critical to reversing these trends. Understanding the statistics behind hypertension's complications helps emphasize the importance of routine blood pressure checks and proactive health care. Because when it comes to high blood pressure, knowledge isn't just power, it can save your life. Reducing the risk of complications from high blood pressure is not only possible, but essential for long-term health and well-being. The good news is that managing hypertension involves practical, achievable steps that can make a significant difference. These steps generally fall into two main categories: lifestyle changes and medication adherence. Both work hand in hand to keep blood pressure under control and protect vital organs from damage. First, let's talk about lifestyle changes, which are often the foundation of managing high blood pressure. One of the most important adjustments involves diet. Consuming less salt is crucial. Experts recommend keeping daily sodium intake below 5 grams. Too much salt causes the body to retain water, increasing blood volume and, consequently, blood pressure. Opting for fresh, whole foods and avoiding processed items can dramatically reduce salt consumption. Incorporating more fruits, vegetables, whole grains, and lean protein supports overall cardiovascular health and helps balance blood pressure naturally. Physical activity plays a vital role as well. Engaging in at least 150 minutes of moderate exercise per week, such as brisk walking, cycling, or swimming, strengthens the heart and improves circulation. Exercise helps the body use insulin more effectively, lowers stress hormones, and promotes weight loss, all factors that contribute to healthier blood pressure levels. Even small increases in daily movement can add up, so finding enjoyable activities is key to staying consistent. Quitting smoking and limiting alcohol intake are equally important. Tobacco causes blood vessels to narrow and stiffen, compounding the damage high blood pressure already causes. Alcohol, especially when consumed excessively, raises blood pressure and interferes with medications. Reducing or eliminating these habits supports better vascular health and enhances the effectiveness of other treatment efforts. Weight management is another critical aspect. Excess body weight forces the heart to work harder and is strongly linked to higher blood pressure. Losing even a modest amount of weight, 5 to 10% of body weight, can produce significant reductions in blood pressure. Combining a healthy diet with regular exercise is the best approach for sustainable weight loss. Finally, managing stress is often overlooked but plays a crucial role in blood pressure control. Chronic stress triggers the release of hormones like cortisol and adrenaline that temporarily raise blood pressure. Over time, this can lead to lasting hypertension. Techniques such as mindfulness meditation, deep breathing exercises, yoga, or simply making time for relaxing hobbies can lower stress levels and improve overall cardiovascular health. Alongside these lifestyle changes, medication adherence is essential, especially for those with moderate to severe hypertension or existing organ damage. Taking prescribed medications exactly as directed by a healthcare professional helps keep blood pressure within target ranges and reduces the risk of complications. Skipping doses or stopping medication prematurely, especially when symptoms disappear, can lead to dangerous spikes in blood pressure and increase the risk of heart attacks, strokes, or kidney failure. Regular follow-up appointments with a healthcare provider are just as important. These visits allow doctors to monitor blood pressure trends, adjust medications as needed, and screen for early signs of organ damage. They also provide an opportunity to address any side effects or concerns, ensuring treatment remains effective and manageable. Together, these lifestyle changes and consistent medication use form a powerful defense against the harmful effects of high blood pressure. By committing to these steps, individuals can not only control their blood pressure, but also dramatically reduce the risk of heart disease, stroke, kidney problems, and vision loss. Managing hypertension is a lifelong journey, but with the right habits and support, it's one that leads to a healthier, longer life. Time is limited, so we'll pause here. I hope this video has been helpful to you, even if it has only made a small difference in your understanding or awareness. That means a lot to me. Feel free to save this video so you can revisit it whenever you need a refresher or a reminder. Sharing it with others could be the nudge someone needs to take action and protect their health. Sometimes the right message at the right time can change a life. Managing high blood pressure is not a one-time effort, it's a continuous journey. The silent nature of hypertension makes it easy to overlook, but the risks it carries are very real and significant. From the heart to the brain, kidneys, and eyes, high blood pressure can quietly damage vital organs, often without warning. Understanding these risks is the first crucial step toward prevention and control. The statistics are sobering. Millions of people worldwide suffer from complications caused by uncontrolled hypertension, including strokes, heart failure, and kidney disease. What's even more concerning is that many don't know they have high blood pressure until it's too late. This highlights the importance of regular checkups and blood pressure monitoring as part of routine health care. But there is hope. There are simple yet effective lifestyle changes like reducing salt intake, increasing physical activity, quitting smoking, limiting alcohol, managing weight, and controlling stress. You can significantly lower your risk. When combined with consistent, responsible medication use, these steps can protect your body from the devastating effects of hypertension and improve your overall quality of life. Remember, you are not alone in this journey. Millions are working every day to control their blood pressure and reduce their health risks. With the right knowledge, support, and commitment, you can take control of your health and live a longer, healthier life. If you found this video valuable, please subscribe to Healthy Start and turn on notifications so you won't miss future videos packed with useful health tips and insights. Thank you for watching, take care of yourself, and see you next time.